afternoon, ladies and gentlemen. My name is Nirav Shah, and I am the director of the State of Maine Center for Disease Control and Prevention. I'd like to provide everyone an update on the COVID-19 situation across the state. And today's briefing begins once again on a sad note. Maine CDC is reporting the deaths of 2 additional individuals who passed away with COVID-19. One was a woman in her 70s in Waldo County, and the other was also a woman in her 80s, also from Waldo County. We again take this moment to pause and offer our condolences to the family members of these 2 individuals during this time of grieving, and also use this as a reminder that each and every person that we talk about, each and every case, each and every number is a human and a person with family, friends, and a community, and we always try to keep them top of mind. As of this morning, Maine CDC is reporting 827 cases of COVID-19 across the state. That represents an increase of 31 cases since yesterday. Of those 827, 133 have been hospitalized at some point during their illness, an increase of 3 since yesterday. Right now, at present, hospitals in Maine are reporting to Maine CDC that there are 27 individuals who are hospitalized in non-ICU settings, and an additional 28 individuals who are hospitalized in ICU settings, for a total number of individuals being hospitalized of 55. Hospitals in Maine are also reporting that there are a total of 8 individuals in Maine who are currently on ventilators related to COVID-19. All told, there have been a total of 29 deaths related to COVID-19 since the virus first arrived here in Maine. And 352 individuals have recovered, an increase of 19 since yesterday. There are no new counties that where community transmission has been identified. However, as I noted yesterday, we have confirmed community-wide transmission now in Androscoggin County, which remains the case. In terms of vital statistics that we track, there are a total of 321 ICU beds across the state, 151 of which are currently available. In terms of ventilators, there are 344 traditional ventilators within the state, 309 of which are available. And there remain a total of 240 alternative ventilators available, giving the state right now a total capacity of ventilators of 588. I'd like to turn next to provide an update on the 5 outbreaks in long-term care facilities that Maine CDC is currently working on and working with our partners at those facilities. The first is Falmouth by the Sea, where there are currently 3 residents, 1 staff member who have been affected by COVID-19. Thankfully, there have not been any individuals who have passed away. Yesterday, Maine CDC delivered an emergency packet of PPE, approximately 72 hours worth, to that facility. And we continue to work with them to determine what their needs for PPE, as well as their needs for infection control, epidemiology, and clinical guidance might be as they contend with the situation. Next is the Augusta Center for Health and Rehabilitation, where there are a total of 46 residents who have been tested positive, 24 staff members, an increase of 1 since yesterday, and sadly 2 individuals who have passed away, for a total of 70 individuals overall. At the Maine Veterans Facility in Scarborough, there are a total of 28 residents who have tested positive, which is the same number as yesterday. 14 staff members have tested positive, an increase of 1, and sadly, there have been 2 deaths at that facility. At the Tall Pines facility in Waldo County, there are now 28 residents who have tested positive, an increase of 2 since yesterday. 10 staff members who have tested positive, an increase of 1 since yesterday, for a total number of 38 affiliated individuals, staff and residents, affiliated with the Tall Pines facility who have tested positive for COVID-19, an increase of 3 since yesterday. Also at the Tall Pines facility, there have been now a total of 5 individuals who have sadly passed away with COVID-19. And finally, the Cedars facility in Portland, where there are now a total of 7 residents who have tested positive, an increase of 4 since yesterday. 3 staff who have tested positive, an increase of 1, and no individuals who have passed away, for a total of 10 staff and residents at the Cedars facility who have tested positive. All told, across all long-term care facilities where there are current outbreaks, there have been a total of 112 residents who have tested positive and 52 staff, for a total of 164 people right now, where Maine CDC is working with the facility on investigating outbreaks of COVID-19. I'd like to turn next to provide an update with respect to our supplies of personal protective equipment. As of this morning, Maine CDC has on hand 201,000 N95 masks, approximately 138,500 surgical masks, just over 6,000 face shields, 3,290 disposable protective suits, and just under 10,000 surgical gowns. I would also like to note an error in my reporting from yesterday with respect to the number of gloves. Because of a clerical error, I reported yesterday that we had on hand 227,100 gloves. Again, because an extra 0 accidentally got added when the inventory was being taken, the correct number is today not 227,100, but rather 23,390. Again, because of a clerical error where an extra 0 was accidentally added, which we discovered yesterday evening, I misreported the number. The correct number of gloves on hand is 23,390. We regret that error and want to make sure that we're clear and transparent with respect to what we've got on hand. Just today, staff at the Maine CDC, working with our colleagues at the National Guard and the Department of Transportation, are filling 76 total orders for PPE. Approximately 80% of those orders today are going to congregate care settings, especially long-term care facilities. About 18% are going to your neighbors, again, local fire departments, EMS, and law enforcement. And then a smaller handful are going to hospitals. These are orders that were placed, picked, and packed yesterday and are being shipped out today. I also, again, mentioned that yesterday we delivered an emergency set of PPE to the Falmouth by the Sea facility, where we sent them 1,000 surgical masks, 1,000 gloves, and about 96 gowns, and 48 face shields. Since we began our deliveries of PPE, 1,009 facilities across the state have received at least one shipment of PPE, and many facilities have received multiple shipments of PPE. That just is a testament to the collaboration by and among Maine CDC, the National Guard, the Department of Transportation, and most importantly, our colleagues here at the Maine Emergency Management Association. I'd like to take a second right now to thank our colleagues here at MEMA, under the leadership of Director Peter Rogers. Our teams, the Maine CDC team and the MEMA team, have been acting as a unified force now for several weeks. And I'd like to just take a moment to thank and commend the entire team at MEMA, many of whom right now are working on multiple emergencies all at once. Just in the past week, Director Rogers and his team have dealt with storms, power outages, possible floods, explosions, and of course, a global pandemic, all while ensuring a steady and unending supply of Diet Coke. And so I'd like to take a moment to thank Director Rogers and his entire team for allowing us to use this space and for allowing us to have this unified force. It's been an honor working with each and every one at MEMA, and I'm glad to be able to join forces in this fashion to keep everyone in Maine safe. I'd like to end on a bit of a personal note. Today's Friday, or Tuesday. I've heard it both ways. It's evidently a holiday weekend, but who knew about that? And that's sort of the point. These are very tumultuous times. It's 2020, and I don't know about you, but I thought in 2020 I'd be tuning up my time machine or programming my own personal flying pod. But instead, I've been learning how to use bar soap properly and singing happy birthday to myself 8 to 12 times a day. It's more than confusing, it's downright bewildering. And I've been trying to get a sense of how I, myself, personally feel. I alternate from being upset, disappointed, powerless, confused, and frankly, sometimes unmoored. And what is all of that? At least for me, personally, when I throw it into a blender, what I get is one thing, which for me is grief. I think many of us right now are grieving not only the lives of Maine people who we've lost, but also grieving the lives that we ourselves used to have not too long ago. Our own personal remembrances of things past. The hobbies that used to define us, the habits and haunts that we used to enjoy. For many of us, those have been replaced by nothing. And I think for a lot of us, we're collectively grieving that loss, that rapid, sudden change. And so what can we do about it? Well, first, for me, is to recognize that grief is not a problem to be solved. It's a feeling to be reckoned with and discussed. And for me, weathering these uncertain times entails acknowledging and grieving the routines that we've all lost, and then creating new ways and new routines to move forward. But the second thing is, for me, to talk to somebody. And I ask and have asked each of you to do the same, to reach out to somebody. And when you call up that friend, when you call up that family member, when you call up that shrink in Beverly Hills, you know the one, be open to sharing your feelings of grief. As important as that is, though, it's also important not just to talk to folks, but to listen to them too. You can still be there for people, even if you're not there with them. And just as important as it is to call that old friend, it's just as important to listen to that old friend when they call. Listening really matters right now, perhaps more than ever before. And so when that old friend calls you, please recognize that you may be the person that that individual is reaching out to for their own help. You may be the person that that individual is reaching out to share their own grief. So when that person, that old friend calls you, please pick up the phone. These are difficult times, but I just want everyone to know that in this life, you are not on your own. So with that, we will take some questions from our colleagues in the media to talk about everything that's going on. And today's first question goes to Brad Rogers from WGME.
Thanks, Dr. Shah. You know, from a medical and a scientific standpoint, what do you think of the Trump administration's new social distancing guidelines? And how do you weigh the need to protect the public with the need to reopen businesses and get people back to work?
So Brad's question is with respect to guidelines, a framework that the White House released yesterday, and how we should think about that here in Maine. And we've been discussing that document ever since it was released. I've had conversations, of course, with Commissioner Lambrou, as well as our colleagues at the Department of Labor, the Department of Economic Development, as well as with the governor's office. And there are a few observations I would have, Brad. The first is that one of the things that we all have to recognize is that it's something of a sliding scale. The sooner we open, the higher the risk there may be of a secondary bump in cases at some point, especially if we open too early and without giving adequate thought to ensuring continued public health protections. But in general, Brad, we agree with the tiered approach that's set forth in the document. And so from that approach, or from that angle, the document appears to be a good start. It provides a skeleton. And like all skeletons, it needs more meat on the bones. And so that's what we're working on now. The document really is a floor and not a ceiling. And so our task is to take a look at that framework, think critically about it, and then apply it, keeping in mind the Maine specific context. The document itself contemplates that every state may approach application of the guidelines in different ways, and it may not even look the same within a state. Right now, and I would refer you to a statement that Governor Mills has made, right now, our task is to take a look at the document and figure out how best to apply it in a Maine-specific context in order to avoid that bump that we're concerned about, making sure we keep the scientific principles of public health top of mind. I'd like to turn next to TJ Tremble at ABC 7. TJ? We'll come back to TJ in a second. We will go next to Amy Brown at WERU.
Thank you, Dr. Shah, and thanks for the Prince reference. That was a good laugh for the day. Is there any way, with the numbers the way they are now, increasing every day, that there's any chance that things will be able to go to even phase 1 of Trump's recommendations by May 1st?
Amy's asking about when we might be able to pass through even the first gate that's contemplated in the document. And Amy, you asked the question in reference to May 1st. I can't put any date on when we may have passed through those gates. The document contemplates various types of measures and pieces of data that would need to be satisfied before we could start moving down that pathway of phase 1, phase 2, and phase 3. It's difficult to predict what things might look like on May 1st. As everyone is aware, we have been aggressively and actively looking for cases across the state, right now focused specifically on long-term care facilities. And as a result, we are continuing to see an increase. So we're not sure what things may look like on May 1st. But Amy, what I'll tell you is this. As we think about applying the framework and making it Maine specific, my view is that it won't be a decision. I like to think of this more as a conversation and much less of a single decision that will need to be made. And what that looks like may differ for different sectors. It may look different for different parts of the state. And so looking at any one date for any part of the state for any sector would be a challenge. The way that we approach hairdressers is likely to be different from the way that we approach mass gatherings, for example. So it's going to be different, and that's the approach that we're taking, looking at it from a Maine-specific context, keeping in mind those local factors.
Can I ask a quick follow-up?
Sure thing.
Can you confirm that all 5 of the deaths in Waldo County have been associated with tall pines? Is that accurate?
Well, you know, Amy, really, in order to protect the privacy and allow families to grieve, we're not confirming that. That's been the approach that we've taken with each and every facility, tall pines and otherwise. So I'm not able to confirm that for you, and it's solely because we want to give families that time and that space.
Okay.
Yep. TJ, can we turn back to you? TJ Trimble from ABC 7. Okay, we will go next to Steve Missler from Maine Public. Go ahead, Steve.
Thanks, Dr. Shah. I appreciate it. My question is about staffing at the Augusta Rehab Center. I think you said 24 staff have tested positive for COVID-19 there, and I'm thinking, okay, so who's working, and what is being done to backfill those positions there? I know you've addressed the staffing problem going forward, or the potential for a problem. I guess I'm trying to get a sense of whether it's a problem there right now and what's being done to address it.
Great. So Steve, to confirm, the number you repeated is correct. 24 staff at Augusta Rehab have tested positive. That's an increase of 1 since yesterday. We've had numerous conversations internally as well as with the facility, strictly looking at staffing. And Steve, there's not, I don't have any major updates. We do recognize, as does the facility, that staffing there does remain a problem. They are part of a larger network of health and rehabilitation centers. And so I know that this larger network, this larger corporate network, has been looking to determine how they can bring in staff from other parts of the state and potentially from other states. I'm not sure what the latest on their planning is with respect to that. We've also tried to connect the facility with other hospitals that may have recently furloughed staff. We are keeping very close tabs to make sure that adequate staffing levels are being maintained. Those have, in some instances at the federal level, been relaxed. The federal CMS has also allowed facilities to bring in outside individuals and train them up on the job. I don't know which of those various strategies Augusta Rehab has deployed as of this very moment. And so in order to not give you false information, I would probably refer you to the facility for the latest on how they are implementing their disaster planning and their disaster staffing. But we've certainly connected them and brainstormed with them about available resources. But I don't want to lead you astray. I want to make sure I give you accurate information, and I think the facility would have the latest, to be candid with you, Steve.
Okay, thank you.
You bet. I'd like to turn next to Joe Lawler at the Press-Herald.
Yes, hi, thank you. We were wondering about the Maine's capacity for contact tracing. How many people do you have working right now that do that, and has that increased or changed since a few weeks ago, and do you expect it to change, within the coming month?
Sure thing. So Joe's question is about contact tracing. And that's a term that's been thrown out a lot. You've undoubtedly seen it in the news. It was a key piece of the document that the White House released last night. It's something that we've talked about during these meetings. I've used the term disease detective or a gumshoe epidemiologist. But the more technical term really is contact tracing. And what it entails is what it sounds like. It's a person who touches base with every single positive individual and asks them every single other person that they've come into contact with in the preceding 14 days. Actually, 16 days is the way we do it. You can imagine how difficult that task is. We have, Joe, to your question, we currently have 15 individuals who are working 7 days a week doing nothing other than contact tracing. We've also, since we began our COVID-19 work, expanded that number I forgot what we started with. I think it was on the order of about 8 to 10, and so we've increased it by about 50%. But in light of the increasing number of cases in Maine, we also are working to we're also working to double that number within the next week. So our goal is to be at approximately 30 individuals within about a week from now. Now, that takes a lot of legwork, it takes a lot of paperwork, it takes a lot of training, but that's where we are right now. We are certainly looking to expand that number of individuals. We've already expanded it, for example, by asking some public health nurses to join the contact tracing force to essentially go from nursing to disease detective, but we're looking to expand it even more, recognizing the role that they will play going forward.
Can I just ask real quick, are these, when you say you're going to double it, are these existing people within Maine CDC that you're going to repurpose or new hires?
It's a little bit of both. So right now what we've done to increase is to repurpose, for example, public health nursing. The next phase is to bring back epidemiologists who may have recently retired from Maine CDC, to ask them to come back on a temporary, several month basis as a contractor. And then the third phase is to look for other individuals who may not have been disease detectives in their former life, but may be skilled in the ways of medicine and epidemiology, who could be trained up to become contact tracers. That's the third phase. That one is probably, candidly, Joe, a little bit further off. Right now, our focus is on repurposing and bringing back folks who have recently stepped down from Maine CDC. I'd like to turn next to Brian Sullivan at WABI.
Dr. Shah, we've had multiple inquiries here at the station about the Brewers Center for Health and Rehabilitation having cases of the coronavirus. Can you tell us if any dealings that the CDC has had there?
Yep. So Brian's question is about the Brewers Center for Health and Rehabilitation. Happens to be owned by the same corporation that manages the Augusta facility. We have had multiple calls and meetings with them. There is a single case of coronavirus there. We have universally tested, actually, that entire facility. And after doing that testing, we've only detected one case. So right now the discussion is where we go from here. It brings up questions that we've talked about in these meetings. But as of about 10:30 this morning, we are only able to confirm one case at that facility.
Can you say if that was a patient or a staff member?
It was a patient. Or a resident.
Thank you.
Yep, you bet. I'll turn next to Don Kerrigan at News Center. Go ahead, Don.
Good morning, Dr. Shah. Thank you very much. I have a question about long-term care and then a question about testing, if I could. The long-term care question first is, have you told all of these long-term care facilities, not just the 5 you mentioned, or even 6 with the Brewer one, but all of them, to be screening every employee, every staff member, every time they come into the building to make sure they don't have a fever or any other symptom?
Can I just answer that one really quickly, Don?
Yes.
The answer is yes.
Okay. For all facilities.
Yes, that is correct. That is, and Don's question, just to repeat it, Don's question is, has Maine CDC advised facilities to screen all individuals coming in to any facility for signs and symptoms of COVID-19? And the answer is yes. I believe we put that guidance document. Don, if I get these dates wrong, then we will correct them, and Robert will be in touch with you if I get this wrong from memory. But my recollection is that we first made the suggestion on March 9th in a written document, and then on March 15th upped our suggestion to you need to do this. If I'm incorrect on those dates, then we'll clarify it for you, but that is the official position and recommendation of Maine CDC.
Okay. The other question about testing relates to this whole larger issue of opening up the economy. Governor Mills has said that one of the things she would want to see, in addition to fewer cases, is a lot more testing. So how would you actually accomplish that? Would you have to get a lot more of the Abbott Labs test, a lot more supplies to test significantly more people than we do now?
Don's second question is about what does expanded testing look like, especially in the context of this document the White House put out, this framework. And Don, you're correct on all three. Expanded testing looks like going up several notches on the volume dial with each and every one of the testing platforms that's currently being used. So we would need to be able to secure a healthier pipeline of reagents, chemicals, from the federal government so that our laboratory in Augusta could continue to test folks. Right now, our capacity is at a few thousand tests. We would need that to have a much bigger buffer so we could offer testing to a much broader swath of people. That's one piece. The second piece is making sure we have, again, a healthier supply of rapid tests, because rapid testing is a key strategy for us in two scenarios. The first are individuals who could be lost to follow-up, as it's called. So someone who may not interact with the healthcare system too frequently, someone who might be experiencing homelessness. If they come into a clinic with signs and symptoms of COVID-19, we need to be able to tell within minutes whether they've got it, not 24 hours, because they may not come back. So that's another key strategy. The third strategy, Don, that you didn't mention but is also really important is this so-called antibody testing. There are more tests that are coming on the market right now that can do this antibody testing. Right now, we're trying to study which strategy for antibody testing is right for Maine, because once we can determine who's been exposed, we can make easier decisions about who can enter the workforce. So we absolutely agree. Obviously, Governor Mills is exactly right. More testing is fundamental and foundational as we think about any plan to reopen. I'd like to turn next to Charlie at the BDN. Go ahead, Charlie.
Yes, hi. Can you hear me, Dr. Shah?
Yep, go ahead.
Okay, thank you. So my question is kind of continuing with the economy opening up sort of subject. You may have heard that there's going to be a rally outside the Blaine House that has to do with the restrictions on businesses in Maine. And it seems like there could be some more unease the longer these restrictions go on. How do you see the difference in the COVID-19 cases around the state between different regions from sort of a public health perspective? And then what would you consider if thinking about opening certain areas of the state before others?
Great. So Charlie raises two questions. One about ways in which the COVID-19 epidemic differs in one part of the state versus another, and then how any of that might relate to a phased reopening. Two great questions, Charlie. The first is the epidemic is different in different parts of the state. For example, we now know that there are a number of counties where community transmission is occurring. And we've talked about those: Cumberland, York, Penobscot, now Androscoggin counties. What that means is that for anyone who lives in those counties, we know that the virus is actively circulating. It's there, it's around, and any individual you interact with could be carrying it. That's different from other parts of the state. Other counties like Washington and Aroostook County, where there are a handful of cases, as well as Piscataquis, which right now doesn't have any. Even though those counties have fewer recorded cases, I still recommend that everybody act and behave and go about their lives as if it's there. And that's because it's possible that it just hasn't been detected yet. Now, Charlie, your question is about what any of this means in terms of reopening. And in the same way that there is not a single unified outbreak of COVID-19 going on across the country, right? Maine looks different from New Orleans, which looks different from New York, which looks different from Los Angeles. Even within the state, there are differences. And those differences will inform the way that we reopen. And that's really why we think this phased or tiered approach is the right approach. Again, to go back to the metaphor, even though we've gone up the stairs, we'll start going down, but the rate at which we go back down the stairs may differ from one part of the state to another. And that will be informed by these scientific and epidemiological differences. It won't be one size fits all. I would like to turn next to Steve Porter at Seacoast.
Thank you, Dr. Shah. I had a follow-up question about the relationship between testing capacity and Maine's ability to draft an exit strategy. I know that President Trump tweeted this afternoon that the states have to step up their testing, and I know that you have talked a lot in these press conferences about the limited supplies Maine has received from the federal government, as well as other factors limiting our testing capacity. So to what extent does the state have the ability to step up testing without federal help?
So Steve asks to what extent the state on its own, on our own, can step up testing without assistance from the federal government. And there are some strategies, Steve, but let me make one really important foundational fact. The federal government has asked state public health laboratories to order all of our testing supplies from them, from something that's called the IRR, the International Reagent Resource. It's a branch of the US CDC. And they've requested that we order all of our supplies for them, which of course means that they control the keys. They've got the keys to the castle and are determining when states are getting what. We have worked with the CDC, the congressional delegation, and a number of others to urge them to speed up the release of more of those chemicals from the IRR to the states. My view there has been simple. We're happy to order from you, but that means you've got to work with us to fulfill those orders so that we, as you said, Steve, can step up our game. But we're not just waiting on that. We're not just waiting for the federal government to send us boxes from FedEx. We've also been working with commercial laboratories to ensure that they are able to provide testing for all people in Maine. As of yesterday, there were now 5 commercial laboratories that are offering testing in Maine. And finally, our lab team here in Augusta has been working with hospitals across the state that themselves would like to bring testing on within their own facility. One such laboratory affiliated with Maine Health, Nordex, has already done so, and others are working to do that. So even though the federal government has a role to play here, we're not just waiting around for them to come in and help us out. We're taking matters into our own hands, working with hospitals, working with private companies, for example, as well as with commercial laboratories to expand and bring on as much testing as possible in Maine. I would like to...
Follow up, if I may, Dr. Shah.
Go ahead, Steve.
Could you provide some updated numbers about what you have requested from IRR and what has been released and kind of how that translates to testing capacity?
Yep. So I don't have those numbers right in front of me. I do know that our manager of virology and microbiology frequently puts orders in, and what we get back, what we receive in response to those orders is typically a fraction of what we've actually ordered. We'll be able to provide you the exact numbers of what we've ordered, when we ordered it, and what we got back. I don't have those today with me, but we will definitely be able to get those for you. Now, Steve, I want to just caution, translating any of that into a number of tests that we can do is a bit of a challenge. To go back to my frequently used, perhaps overused baking analogy, it would be like asking, well, I'm going to give you 4 cans of baking powder. How many brownies can you make with that? Well, it depends on a lot of other factors. We'll do our best to get you an estimate of what the supplies we've ordered translate to in terms of the number of tests, but certainly we'll get you all that information.
Thank you.
You bet. I'll turn next to Ashley Blackford from WAGM. Go ahead, Ashley.
Thanks, Dr. Shah. Augusta County went from 3 cases yesterday back to 2 today. Can you explain why that is?
Yep. Ashley, I can't speak specifically to that instance, but what I can tell you is that what often happens in outbreak investigations, very commonly, is we receive initial report of a positive case from a laboratory. And let's just say, for example, that laboratory, let's say the person that they tested might live in an adjoining county, but went to a hospital in Aroostook County. The laboratory where that test was sent to may have reported it as, because the hospital is in Aroostook County, may have reported it as an Aroostook County person. But then when our disease detectives, our contact tracers, call the individual and start going through the questionnaire, one of course, the first questions is, hey, by the way, where do you live? And we might actually find out that they live in Penobscot County, and they happen to be in Aroostook County and got tested there. And so that would account for why the number may have decreased for Aroostook, but perhaps got added on to another county because of where they got tested versus where they actually live. That happens quite a bit during outbreak investigations. I can't give you an exact answer about that situation in Aroostook. I saw the same thing, to be candid with you, but 9 times out of 10 when that happens, it's because we talk to the person and we learn where they actually live is not the same place that they seek health care from. Turning next to Megan from WMTW. Go ahead, Megan.
Thank you, Dr. Shah. I have a question about the federal government's guidelines and the tiered approach to reopening the economy. There was, I believe Dr. Brick cited 14 days with decreased cases, hospitalizations, and deaths. That 14 days, is that a bit aggressive? Because I believe it's generally 2 incubation periods, which with coronavirus would be about 28 days. So is that 14 days a little short or short-sighted? And then my second question is, do you guys study people who are asymptomatic as well and see if they all have something in common?
Okay. So Megan, first question is about what is contained in the White House's document with respect to this 14-day period. Megan, I didn't think death was included in that 14-day marker. I thought it was just the number of confirmed cases, but certainly we can go back and check. But the crux of your question is a really important one, which is this 14-day metric the right one? And the document itself contemplates that different states may wish to take different approaches. You rightly point out, Megan, that we usually look at 2 incubation periods. But that's actually when we start looking at when an outbreak could be declared to be over. Here, the discussion is not about when the outbreak might be over, but when we might just start loosening restrictions. Indeed, I think as you correctly assumed, Megan, it could be quite a long time before 28 days elapses before there are no new cases around the country. So the document is going at a different approach, which is not so much when will the outbreak be over, but asking and answering a different question. Now, it still doesn't answer the basic inquiry of whether 14 days is correct. It's a harder question. I had a call last night with my counterparts from the other 49 states, and we debated this entire exact question, and whether 14 days is not adequate enough. The short answer is that we're not sure yet. For some states, in some areas of those states, 14 days may in fact be the right call. But for others that are more populous, have higher population density, it's not likely to be. So again, this document provides a good skeleton. It appears to be a good conversation starter, but really, truly, like all skeletons, it really does need a lot more meat on the bones. And I want to emphasize again that the way that I will approach this is not as a decision, but as a conversation. Because this will not be a singular decision that any one group or one entity will make. It's going to have to be a decision that we, all of us, make in conversation with one another. Before we wrap up today, I just wanted to take a moment to reemphasize that these are difficult times. They're topsy-turvy. And as much as I've asked folks to reach out and touch base with others, I'd like to do the opposite today, or the corollary piece, which is also to recognize that there may be people out there who are reaching out to talk to you. And I ask everyone not just to share your feelings with others, but recognize that there may be folks out there who are reaching out to you to share their feelings with you. And even though you may be physically apart from them, you can still be there for them, even if you are not there with them. We're all processing the events of the last few months much differently from one another. Each of us is at different stages, going through a different phase, whether it's grief or whether it's something else. And as much as I want folks to reach out and chat with others, I also ask everyone in Maine to be open to getting that call from a friend, an old family member, someone you haven't spoken with, because that person may be reaching out and you may be the person they've decided to reach out to for help. And so please be open to that. And as always, please be kind and take care of one another. We'll talk soon. Thank you all, everyone.